Hello, and welcome to part 3 of our trauma-informed care series for volunteer supporters. My name is Laura Collins with Health Management Associates, and I'm here to introduce you to our speakers for today. Let's move to the next slide, and we've got Dr. Karen Hill and Dr. Judy Martin Holland with us, who you may be familiar with from part A and B of this series. And today they're going to be speaking about practical strategies for trauma-informed care. Let's look at the agenda and cover that. So we've got practical strategies that really discuss tools that help with de-escalation and really help with applying trauma-informed care in practice. We'll also be covering resiliency today in working within the CARE Act. And again, promoting resiliency for those that are supporting the care respondents in the CARE Act. Our learning objectives for today are, we are hoping that you will walk away with an increased ability to list at least 3 self-care activities around resiliency and at least 2 strategies to reduce stress, and generally just an ability to describe how to promote resiliency. And then also an ability to think about the respondent in CARE Act and think about their strengths. So those are our learning objectives today. And from here, I will pass the floor to Dr. Karen Hill. Karen?
Well, thank you. And I'm glad to be with you again for this final session. As Laura said to us, we're going to focus our time today, on some tips and some tools, some things that you really can do to lower those cortisol levels and to provide our key principles of trust and safety and empowerment. So let's talk about how we can provide support to Angela and Arthur. We've been talking to them for the last 2 sessions. Today, we're going to talk to them together and think about how we might be able to apply some of this in their situations. So remember Angela and Arthur in this training. We're going to revisit them, as I've just said. Angela is 46. She's got 2 children, 17 to 22, not on good terms, perhaps due to some of Angela's mental health conditions and the living situations and some of the violence with the partner, history of early adversity, absent father, domestic violence in the home. Spanish is her first language. She's got schizoaffective disorder, type 2 diabetes, high blood pressure, and she smokes. So she's living with some chronic illnesses in addition to her mental health problems, currently hearing voices, experiencing lots of paranoia, and she's not connected to any mental or physical health providers. So lots of problems. She was evicted from her housing, has been hospitalized under 5150 in the last 4 months, several times. So, lots of issues going on with Angela. The family member filed for a care court for services through a petition for care court. And through the court and behavioral health assessment process, she was found eligible she met criteria, and Connie was approved to be her supporter. Connie is a friend. Now, Arthur's situation, we just talked about Arthur. He's our 29-year-old. He's self-identifies as a gay male. He's religiously devout. His family is conservative, if you remember him. Lots of verbal and physical abuse. He has used ecstasy and alcohol, sometimes vapes. And when he uses substances, he can get violent. He also has schizoaffective disorder and an eating disorder. When he's using substances, he's prone to be violent and can fight and get in fights and ends up in jail. His voices get out of control. And he has approved Sam, a cousin, to be a volunteer supporter. Arthur's strengths are that he likes to paint and draw and doodle. And so those are things that help calm him down. So we want to keep both of their strengths in mind as we move forward. I don't think I spoke about Angela's strengths. Angela, she really does care about her family, and she does have English as a second language. And so those are all as her first language, and she's bilingual. So that's really helpful. Let's revisit these 3 E's really quickly. We just talked about those extensively, but I want you to remember that when we talk about trauma and how it affects us, it's the events, it's the experiences, it's how it affects us internally. Those are the things that affect us, and we might never understand all of the hurtful things that people have experienced. However, we're always able to provide a trauma-informed care approach or services. So let's look at some practical strategies of what to think about. In honesty, one of our biggest ways to help our care respondents is to help them to anticipate triggers, things that might reactivate their trauma. Use cultural humility, making sure that we are culturally responsive in our approach when we meet people where they are, and we don't demean their cultures. And if we do make a mistake, we apologize for that. We acknowledge that we don't know everything about someone's culture. We focus on our cross-cultural communication techniques. And we use a strength-based approach. We don't come from a deficit-based approach. Every human being has strengths, and we need to know what those are and tap into those things. We want to use our trauma-informed listening skills. We'll talk more about that. And hold space for individuals. Those might be new terms for you, but we're going to talk about those as we move through these slides. So let's talk a bit about how to anticipate some of those triggers that we might have, right? Or what to do, how to reduce when folks are triggered. We want to anticipate them, and we also want to know what to do. So we know if people are coming to us where they haven't slept well, it's noisy, maybe they're watching TV all night, or there's a lot of light in their room. We want to encourage quality sleep, making sure that people, to the best of their ability or of the best of how we can help them, to get balanced, nutritious meals. We understand that many times people who are living in substandard housing, or maybe they're not really housed to the best of ability, insecure housing, they might be eating in food kitchens and so forth, but helping them to eat as healthy meals. So foods that are minimally processed, fruits, vegetables, some good proteins, getting as much physical activity as possible. Nobody has to run a marathon, but even 10 to 15 minutes of a nice walk or a stretch helps to reduce that cortisol level and helps to relax us. If we know that we have an upcoming event that's going to be stressful for us, that we've slept, that we've had a good breakfast, if we can get that, or lunch, did a little bit of exercise, relax our minds, some deep breathing. Those are stress busters. Maybe take that walk in nature if you can. Perhaps if you have a court appearance coming up, or maybe you've got an important meeting coming up, the respondent maybe they need a visit with their mental health provider to help them think about that and to plan it out. So that they have some understanding about what's coming up for them, and to make sure they're connecting with their support system, you or other family members. Those are all things that we can help to reduce and anticipate triggers. Let's find out a little deeper now about cultural humility and how it plays a role. Judy?
Thank you, Karen. In the last module, we talked about someone's cultural context and how that can impact both their experience and their response to trauma. An important tool for trauma-informed care is demonstrating cultural humility, which is the ability to center and empower someone else's experience and culture. Cultural humility is defined as the ability to maintain an interpersonal stance that's other-oriented. What does that mean? It means we are not the focus of attention in our interaction with that other person. It's our ability to step aside and to pay attention to what that person is saying, what their experiences are, and how we can support them. We also recognize that the other person is the expert of their experience. Cultural humility is a guide that emphasizes the power relationships and understands cultural identities. So in enacting cultural humility, we want to make sure that we are flexible enough to engage both in our own self-reflection and self-critique, as well as to understand that everyone else and their culture and how they experience it deserves our respect. It's okay to admit when you don't know someone's culture or social context, particularly for your care respondent. Use the resources that we've been sharing in these presentations to broaden your understanding of others' cultures and the communities that you are serving. Know that that care respondent is an expert of his or own culture, values, and beliefs. Put your assumptions aside when working with them and ask them to share their thinking, their resources, and their experiences with you so that you can understand better. Next slide. Given our connection between culture and trauma, it's important that we use cross-cultural communication skills. Even when you consider yourself a part of the same cultural group as the person you're working with, remember there are so many ways in which different people who look like us or may come from the same culture experience that culture differently. So a few things to keep in mind. Learn about the care respondents' cultural norms regarding personal distance, gestures, eye contact, and posturing. Become familiar with their communication style. In particular, do not make assumptions that because they are an individual that may be from the same ethnic or racial community, or they may come from a different racial ethnic community than you do, that you understand their culture. Here is an example of some questions that you could ask them. What kind of food do you like to eat? What kind of music do you like? How do you prefer that we discuss difficult news if it ever comes up? I want to make sure I understand that you're comfortable. Can you let me know when you are feeling uncomfortable so that I can help support you? Those are the kinds of things that will give you some insight into what you can do to help support your care respondent. Let's talk a little bit more about cross-cultural communication using the framework of respect. This framework is just wonderful because it makes us all sort of sit back and think about how do we approach people who come from a different cultural perspective than we do. The first is to understand how respect is shown for that person. And if you're not sure, you can always ask them. We can embrace humility, recognize that we're all different, and approach people from that standpoint. As we look at the cultural context, we recognize that our culture and our experiences impact our decisions. It also impacts our participation preferences. You can support individuals by showing empathy. express concern, and share experiences with them. Those experiences can be yours that are similar, but also recognize that they're not the same. And at this point, using our cultural humility, we're keeping their experience centered. You can talk about concerns and fears and ask them about their apprehensions. And then lastly, you want to build an alliance. Trust, as we all know, must be earned, and this is your work as a volunteer supporter, to earn the trust of the recipient. Next slide. We talked a little bit in the past presentations about implicit biases. So we just want to bring them back before you. We don't want them to be implicit any longer. We want them to be content. The definition, again, is here. It's a tendency or prejudice, usually the use of a stereotype, to automatically respond to someone, whether it's with attention or without. Remember that we all have implicit biases, and it's a normal part of human functioning, except that racial and other biases exist, and those biases are going to affect your day-to-day interactions, both on your part and your response to others. Just remember that your care respondent has their own biases as well. So how do we address our implicit biases? As the volunteer supporter, it certainly is most important for you to address your own implicit biases. And there's several strategies on this slide that can give you a little bit of a tease of how you can help to mitigate your own implicit biases. The first is called the habit breaking routine. The title's not important, but the key is to be curious about the other person. When they're speaking, don't interrupt. Monitor your own nonverbal behavior. You don't want to be rolling your eyes or smirking, right? You want to look intently as if you are paying attention to your best friend or your best bud. You want to do that for the care respondent as well. Make it a habit. Do it regularly. There's this process called if-then planning, in which you identify those things that you recognize can be a little bit of a trigger for you to just take over a situation, right? Sometimes we can become a little impatient. If-then planning can help us with that, because we can set a goal for ourselves to say, you know, when Arthur, for example, has trouble getting his thoughts or his speech organized to communicate what's really going on with him, I, instead of just taking over and starting to talk over Arthur, will just stop for a second and then plan ahead by saying, I want Arthur to know that I want to be able to hear him and to support him in this process. You can actually just say that, Arthur, I want you to know that I want to be able to hear and understand what you're saying and support you in this process. And so when I am getting a little confused about what you're trying to get across to me, I'm just going to stop and listen for a bit and then repeat back to you what I think I'm hearing so we can make sure that we're on the same page. The last strategy that's on this slide is mindfulness. The important part of mindfulness is just to keep your attention on and in the present moment so that your mind doesn't wander off in other directions. Stay focused on Arthur or your care respondent. And again, stay attuned to what they are saying to you. Take the time and really work to tame your own thoughts and feelings by remaining present in the current moment. Don't just react to what they're saying. Stop for a moment and think. Focus on what's happening and focus on how you're about to react to it. This can allow you to be more compassionate in your response to Arthur. Karen, I think you're going to talk to us a little bit now about taking a strength-based approach, right?
I am. And thank you, Judy. You know what? Those are three great tips. Habit breaking routine, if then planning, and mindfulness. Those are perfect. And those are exactly what is going to be needed in this role. So I want to take a little bit of time to talk about take a strength-based approach. We could talk all day about what is wrong with Angela and what is wrong with Arthur, but that doesn't move anybody towards wellness and health. You know, in the past, our medical model, and behavioral health model as well, focused on what was wrong with individuals. A trauma-informed care approach is let's look at the strengths and let's think about what happened. Let's understand that the individuals in front of us have had issues of trauma and have had things happen to them that are really impacting the way they move and think and are in the world. So what we are hoping to do is develop and promote hope. It's not hopeless. To encourage people to ask for help and know when they can get help. That's why you, the volunteer supporter, are there. Encourage strategies for self-calming. Take a moment. Use that mindfulness to deep breathe. If it's painting, if it's walking, if it's singing, ways to self-soothe. Encourage people to help make decisions and make them feel empowered by strategizing with them and coming up with plans. And then also to come up with a way that just because things don't always go exactly how the care respondent may have wanted them to go or how you've wanted them to go, that we don't fall apart when that happens. To have strategized about what to do next. What are our next steps? Allow for that experience of success and failure, and always tap into strength. So, for example, Arthur may feel hopeless about controlling his emotions or a situation. As a supporter, you can make sure he knows that there are people who care about him and that are willing to help. And this is really important. You can suggest to him about how much improvement that he's made and how his painting and how he's interested in getting some help around his substance use. These are all strengths that give the care respondent hope, because oftentimes folks who are experiencing mental health issues and concerns can feel very hopeless about what can be a very chronic problem. When we think of Angela, she may be very depressed when, after reaching out to her children, that they continue to reject her. It takes a long time to rebuild that trust with her children. And that's something that we might want to talk to her about. She doesn't know how to make amends, and she can practice that with either you as a volunteer supporter or with a mental health provider to give her some strategies for rebuilding her family. And then to understand, if she's disappointed, that it's not hopeless, but that it may take longer than she anticipates. You can help her by problem solving and suggesting ways that she can connect with her family and connect and that connection may come through with a family meeting with a mental health provider who can help work these things out with them. So in closing, we want to develop hope. We want to empower people. We want to have them ask for help, know when it's beyond what they can do on their own, to recognize their own triggers and have some strategies for how they can calm themselves down, experience that success and failure, and to also remember that they have some talent, some of their own talents. And we do a lot of this learning in understanding and being able to really appreciate our moments and provide the best of our support for the respondents when we use trauma-informed listening skills. When we use those skills, let's go to the next slide. What does that mean when I say that? Authentic communication is essential when establishing, building, rebuilding, and maintaining trust. There may be times that you and the respondent have a difficult time communicating, but using this trauma-informed listening can help mend those situations. It's easy to not truly listen when somebody's talking to you, maybe being on a computer or checking your phones or something. However, people often know when you're not paying attention to them. They know when you're thinking about something else. So some skills for you are to be in the moment with a person. Look at them if that's the way that they can understand it. Sometimes looking somebody directly in their eyes can be intimidating, but nod your head. Let them know that you're hearing. Say, I understand. Reword what they're saying. Maybe you don't quite understand it. Judy said to us, I really want to be here and support you. Use some of the terms that we just learned just a while ago. Those are all really great strategies of things. Clarify if you don't understand. I think I'm hearing you say whatever it is. And have the individual explain it to you. Be able to summarize what you've heard or what you thought you've heard. That way people know that you are actually paying attention when you use those summary statements. And then finally, I want to talk a bit about holding space. I used that term a little bit earlier. What does that mean? When we're holding space for somebody, we do this without judgment. We're bringing in our cultural humility. We're checking our implicit biases. We're using all of the tools in our toolbox. We're donating our ears and our hearts without wanting anything back. We're practicing and using our empathy and compassion. We have individuals who are living very difficult lives. To accept someone's truth, to embrace somebody's experience without pointing any fingers at who did what wrong and you should have and I told you so. We come with the spirit of neutrality and of learning and trying to just give an individual a chance to express their feelings. This is about them and it's not really about you. Holding space means that you put your needs and your opinions on hold and you allow somebody else to be themselves. We talked about this earlier on, and it's much easier to talk about than it is to really do, because oftentimes we feel and we think we know what's best. And sometimes we might know what's best for an individual. But when we're talking about collaboration and autonomy and building something together toward wellness, individuals may make choices that we don't always agree with initially. And so that's what I'm talking about when I say holding space for individuals. Okay, so now we're going to have some ideas in action. I brought Angela and Arthur at the very beginning, and so we're going to talk about that. We know that that Arthur's got this upcoming court date. His last one, his appearance wasn't very good. He's still hearing some voices, and it was just difficult, right? So we can help Arthur help be less anxious because he's nervous about this one by helping him to plan a little bit better. His last court appearance, he was late because he didn't exactly know where to go. We can plan for that. We can even do a trial run there, as we talked about in the training too. He can work. He was up late working and didn't have time to address his hygiene. He was working on his painting. We can remind him that his court date is the next day and that he should get some rest, that he needs some sleep. We can remind him that, yes, we know he's still hearing voices, but he's better able to control those voices. And so that gives him a sense of empowerment. and he hasn't been drinking so much, and he hasn't been in any fights. So he's really in a much better space this time for court than he was the last time. And so, Judy, do you want to chip in here with anything about what maybe we can do with Arthur and or Angela? Angela's having difficulty with her children. What could we do to help her and support her?
Well, Karen, I think using silence sometimes is just the perfect antidote when there's a lot that's going on and it feels like people are having a hard time just sort of staying focused on what's in front of them. So as you look at Arthur and you ask him about his drawing, since that's what made him late, clearly that was important for him that day. We can ask him about his drawing, talk with him a little bit about the next plan for attending court and what you can do to support that while he's drawing. The key is not to lecture or become directive. Mm-hmm. What has happened. It's already in the past. So how do we help prepare Arthur for the next appointment, for the next difficult thing that there is to do? Perhaps you go out and you take that 3 to 5 minute walk with Arthur, and you just talk and let him be calm, but you can be silent and give him a chance to sort of think things through. And that will show both your empathy and your compassion, because you'll be holding space without judgment, just as Karen explained a little bit earlier.
Those are really good tips. And Judy, those same tips would help with Angela. She wants to really rebuild her relationship with her children. And so some silence and asking her questions, just listening and not sort of telling her what to do. How does she think she can do that? Taking a walk with her as well as you talk these things out. Maybe asking her for sure, is she willing to see a mental health provider to help her plan? And maybe what they need is a family conference in a nice sort of a neutral way to work things out. So I think that some of the same things that have worked for Arthur could work for Angela. We find out more about what she wants to do. Perhaps she really needs to have a healthcare provider, a mental health care provider that speaks Spanish, that she can really say how she feels. So those are all things that might work, where we use our cultural humility, where we respect her choices, perhaps actually just giving her a few minutes to get her thoughts and her feelings together about how to approach building one of the most important relationships that she may ever have, is one that she wants to rebuild with her children. So let's talk a bit about how do we continue to promote resiliency. We're not going to stop every negative thing that ever happens to an individual. What we can do is build resiliency so that individuals can have tools in their toolbox. Care respondents have tools, things that will help them to combat those negative things that happen in life, right? And we also have to do this for ourselves. So when we talk about promoting resiliency, it's resiliency for our care respondents and resiliency for us as we do this work. Let's go to the next slide, because one of the hardest things to do, however, it's the most important thing to do, is for care providers is to take care of themselves. This is really difficult because we're so used to giving. It is self-care that restores our energy and builds that capacity for us to be able to give. And we often neglect that and really risk burnout. And so that's really important. And that's partly what a lot of this is about, taking care of you. And then you use these skills to help your care respondents build their own capacities for resilience. So one of the things we can talk about is self-monitoring our own mindfulness. What do I mean? There may be situations and times when conversations or experiences between you and the care respondent are very difficult. When you're trying to perhaps convince them that they need to go to court, or perhaps have them consider seeing a primary care provider or mental health professional. Pay attention to that immediate experience. Allow for increased recognition of events that happen. When things go bad, think about it. Don't just bottle it up on the inside. What are you feeling? What are you thinking? Be curious about that and talk about it with yourself or out loud or with other people who care for you. That's somebody, a trusted person. You are a volunteer supporter for the individual, but you need to have somebody for yourself. We like to actually talk about sort of an I am safe checklist. And I want to talk a little bit about this. Sometimes when you kind of do that head to foot scan, you think, am I really sick? Do I really not need to work today? Am I taking some medication that's making me feel weird, or making me sleepy or tired or anxious, or upsetting my stomach, giving me headaches? Is there undue stress happening, not only in your work, but in your private life with you personally? Am I using substances, alcohol and drugs, perhaps to monitor that stress? Pay attention to that. Am I just flat out tired? Do I need to sleep today? Am I getting enough rest? Am I trying to do too much? We have to rebuild our bodies, and sleep and exercise and rest help us to do that. Am I eating well? Am I having all fast foods? Am I eating in my car as I'm running from place to place? Am I taking time to take care of myself? Am I really nourishing my body and my spirit? Make sure you use that self-care checklist. We're trying to give you some tools that help you to take care of yourself. Let's go and talk a little bit of how to recognize and avoid burnout that can happen in this work. Judy, you want
Thanks,
to
Karen.
talk a little bit about that? Yeah.
Absolutely. So the work of supporting someone else, we've given you a lot of strategies, but even with all of those tools and strategies, supporting someone else through a difficult period in their lives can be very taxing. And burnout, which is both mental and emotional fatigue, is real, and it can happen to you as a volunteer supporter. So we want you to recognize as early as possible that you are beginning to burn out. There's a reason for that. Constant and exposure to commitment is very straining. The loss of hope, a lack of progress, the accumulation of intensive contact with a person that continues to require your support, all of this are several factors that can cause burnout. And it is the life of a supporter, of a care supporter, a caregiver, and a volunteer supporter for the care recipient. What does it feel like? It feels like you're overwhelmed. You just can't accomplish all of the things that you need to do. You might feel that you're getting emotionally irritable yourself, that it's really hard to show empathy for your care respondent, or quite frankly, anyone else. You might begin to feel a little helpless. The whole situation with your your respondent may be so overwhelming to you that you feel helpless in trying to help them. Sometimes you'll experience interpersonal or communication problems, feeling you just want to stop or quit or not keep your own commitments, let alone helping somebody else with theirs. And so many of us will start to do what is called self-medicating. What we're really saying is we depend a little bit more on cigarettes or drugs or alcohol or sleeping, keeping ourselves away from others, just because we're trying to cope. Well, those are not the ways to try and to cope. And so we're going to talk about some of the self-care that you can do as a volunteer supporter to reduce your own stress levels, to put safety first, and to celebrate both the wins as well as mourn the challenges. So what do? Remember that vicarious trauma that we talked about a couple of sessions ago is not what just happens to somebody else. It's that it can definitely affect yourself. This type of trauma can add up and it affects us emotionally. And if we're not careful and we don't try and protect ourselves in ways that are helpful to bring our own cortisone level down, then we will do things that are not helpful and that can put our own lives in danger. So the key is to reduce your stress levels. Remember in the last training, Karen talked about going out and taking that walk, having some time to do some mindfulness and deep breathing and stretching, listening to some music that you enjoy. Give yourself a break. Unplug from technology. You know, technology seems to be the thing that we turn to when we have a quiet moment. But so much of what's pictured in social media, everybody's out having a great time. And here you are struggling with, a care respondent. That's not really what you need at this time. It can really affect you. The news is so depressing sometimes. Turning off that television, staying away from, reading those news alerts on your phone. This is not the time to do any of that. Just unplug from technology. Give yourself a break. And what's the other thing that you need to do? It might seem a little strange, but after you've had that break from that phone and you've gotten away for a second and you've gone for a couple of minute walk or you've been out to stretch a little bit, the thing that you need to do is to schedule time for yourself. So pick up that phone, open up that calendar, and commit to wellness for yourself. Not just when you're feeling overwhelmed, but make a commitment to do something to keep yourself well every day of the week, at least 4 to 5 days of the week. Set a realistic goal. That's why I dropped it from every day of the week to at least 3 to 4 days of the week. Set a realistic goal. Schedule to do it first in the day, whether it's going for that walk, just sitting down with your cup of tea or coffee and having quiet time away from your kids or family, anyone else that's in your life, social media put away, television off, just have those few moments for yourself. The other thing is, the things that make you happy, those things that that are pleasurable to you, and not those self-medicating things we were talking about, but the other things that you do that make you happy, do that. Find some time at least once a week to schedule in that time. So you reserve that hour for yourself or that half hour yourself and take yourself to your happy place. As we talk about SOS, which is self-care on the spot planning, these are some of the things that we read about in the literature that can help people with self-care. Listening to their favorite music playlist, a little aromatherapy, fill up that bathtub, get those scents going. Do anything that will allow you to step away from the situation. Now, I'm not into the squeezing the ball piece, but my husband definitely is. He'll just sit there and squeeze one of those little balls, and you can just see him start to relax. Take a brisk walk. Do a 3-minute stretch break, a short meditation, or just 2 or 3 minutes of deep breathing. Remember how we talked about how that drops your cortisone level in the one of the past trainings that we had. Karen's going to talk to us a little about cultivating gratitude, which is also a way to take care of ourselves. Karen?
Thank you, Judy. Gratitude, cultivating gratitude and being grateful really is in the literature, talks about that it helps our immune systems. It lowers our blood pressure. It makes our immune system stronger and lowers our blood pressure. And so that may be an interesting thing for us to think about. It helps us to celebrate the present. No matter what's going on in your life, no matter how bad your day is, it can certainly be worse. And so what we're suggesting for you to do is to block some of that toxic stress and the toxic things that happen and toxic emotions by saying, well, yeah, this is happening, but you know what? I'm really glad that I can see that the sky is blue and that I can hear music, that I can eat, that I have a roof over my head. It's always good to be, that my health is relatively good. Perhaps I have high blood pressure and other things, but my blood pressure is controlled. Always be grateful. So how do we think about that, doing this? You can do it in a journal. You can just speak it out in the open. You can write it on your phone. Just every day when you open your eyes, name one or two things that you're grateful for. It doesn't have to be some fantastic thing. I'm happy that I woke up this morning. I'm happy that there's nobody in my family that's sick. And if somebody is sick in my family, that they're still well and they're still here with me. Lots of things that gratitude does. It helps us physically, psychologically, and socially. When we identify and speak what we're grateful for, it makes us feel less lonely and more compassionate. Perhaps an interaction with the care respondent went so much better than you thought it was going to be. You might have had some difficult news, and the person, when you gave it to them, they actually took it much better than you thought. Be grateful for that, because you know how things could get. So there's oftentimes, if you go to court with the care respondent or the Social Security office or wherever, and things went okay and they took the news well, be grateful. I also want to talk again, we talked a lot about resiliency in the beginning. We're going to talk a little bit more about resiliency, give you some building blocks on that. How do we build that resiliency of what we're talking about? It's sort of like walking up these stairs that we see in this picture, thinking ahead about consequences before we act, right? Helping your care respondent to think, if I do this, then this is going to happen. Setting clear expectations and boundaries around whatever your work is with them, that they understand the boundaries in a living situation, they understand the boundaries within court, they understand the care respondents' role and responsibilities, letting others know that you're available for help, that you're there to help them. And there's often people that they can help. Developing positive relationships, self-esteem by identifying for individuals what they do well. Those are all things that build resiliency. Helping people to give themselves permission for expressing their feelings in healthy ways. Acknowledging when a mistake was made, because we all are going to make mistakes in our lives. Developing communication skills, using that trauma-informed listening and using that really trauma-informed communication, not re-traumatizing, and helping to develop those critical thinking skills, meaning understanding our consequences and thinking ahead and planning for your life. These are all things that help people to be stronger and to bounce back from adversity. And when we have when we use and develop those building blocks, it also helps to develop the adaptive behaviors that we would like to see. Let's talk about some of those, Judy. Adaptive behaviors.
Absolutely, Karen. So we're coming to a close of our discussion of trauma-informed care. We've given you some strategies and approaches that we've discussed over the 3 trainings that you've been a part of. But in particular, around adaptive behaviors, these are the things that you're going to want to attend to first. Keep scheduled appointments. Following up on the care plan or agreement. Once you have that agreement with your care respondent, then you're going to keep track and follow that plan of care. Contribute and participate in self-care. That's what we've been focusing on in the last few slides. Seeking assistance when needed. Being open to respectful guidance and feedback. Being knowledgeable about self-care strategies and implementing them as you need it. Seeking safety and finding a path to wellness and stability on your own. As we move to the areas of putting some of these ideas in action, the questions that you might ask yourself are, what are you currently doing that you will stop doing because it isn't working? A couple of things that come to mind may be judging people before you know them and making assumptions. We're going to stop doing that. You may have other things that you're thinking of that you would stop doing because we've given you additional strategies and tools to utilize. Second question, what haven't you done that you will start doing because it may work? Well, how about scheduling time for yourself? Extremely important so that you can make sure that you're taking care of your own well-being and that you can avoid burnout. You might also run your own I'm safe checklist, as Karen discussed a little bit earlier. It's a way to make sure that you are in a safe space, that you are safe. And then third question, what are you already doing that you will continue to do because it works well? Well, first of all, you volunteered to be a volunteer supporter. You're going to hone in on your active listening skills, and you're going to show empathy and compassion and humility to your care respondent. In summary, trauma-informed care means approaching an individual with cultural humility and empathy, centering that individual and their needs. Creating strategies that are required to promote resilience and apply trauma-informed strategies and principles, including the core value of empathy. This work includes self-care, self-reflection, and mindfulness. This work also requires planning, collaboration, and communication. I think now we're ready to turn it over to Laura.
Thank you, Judy, and thank you, Karen. We have completed part 3 of our trauma-informed care series for volunteer supporters, and we wanted to just reflect briefly on the learning objectives for today. So think about those self-care activities that we talked about today, strategies to reduce stress, also strategies around promoting resiliency, and thinking about how to promote and identify the CARE Act respondent strengths. So let's move to the next slide. And once again, just providing a reminder about our care-act.org website. That's our CARE Act resource website that has all these past trainings uploaded to the site, among other resources. And it's also a site where you can submit your questions and technical assistance requests. So again, we already have part 1 and 2 of our trauma-informed care series for volunteer supporters uploaded, and you will find them on the website. And again, go to the next slide. We also have that email, info@care-act.org, where you can again submit questions, also feedback regarding this training, and any other TA technical assistance requests. And finally, on the last slide, we always like to provide the resources, both that we used to inform this training and additional resources for your work as a volunteer supporter. And with that, I'll close and thank you all for participating in the Trauma Informed Care series for volunteer supporters. Thank you.